So early orthodontic treatment, at what age should you take your child in? And obviously you're talking to the parents right now.
Well, every child gets 6-year first molars. And as soon as those first molars come in, the orthodontist can already tell if the jaws are proportioned properly.
Okay.
So by age 7, every child should have an orthodontic evaluation.
What's wrong with the pediatric dentist? With all due respect to them, but why see the orthodontist as well?
Well, the orthodontist can change things that may need to be changed
Okay.
at that early age. And especially when it comes to growth modification. If there's a situation where the jaws are not growing properly, that they fit together properly, that is the situation that needs to be addressed at the earliest age possible, because it can prevent serious problems from occurring later on. We can make room for teeth where there's not enough room. We can correct jaw proportions. We can correct posterior crossbites. So in that respect, it's very, very important to get in early.
Because my original thought was that you had to wait until the teeth come out to see an orthodontist. I mean, until you get your permanent teeth is what I meant to say.
When you get the permanent 6-year molar, and then following that, you get your upper front teeth at age 6 and 7, you can already see when there's a discrepancy.
Give us some tips. Okay, so parents that are watching this, what are the obvious ones that they really need to get treatment? Like, what do they look for in their child's mouth?
Well, I would say the number one thing to look for is a shift. If you see your child shifting to one side or the other, or you get the
What do you
complaint.
mean shifting? I don't know what that means.
There's a shift.
Okay.
Instead of biting straight up and down, you go to the left or you go to the right. Or maybe your child complains that they're biting their cheek a lot. That's a sign of a crossbite in the posterior.
Interesting. Okay.
Or if the tooth sticks out at rest, when the lips are closed, you see the tooth. That's a sign of protrusion. Or if there's an open bite, when the child bites, the teeth don't touch in the front. That can be caused by thumb sucking. That's a serious problem. Teeth could be spaced extremely widely, so the child feels very self-conscious about smiling. Or teeth could be crowded on top of each other.
Okay.
So all of those things can be seen age 6 or 7.
Give me one scare tactic. You know, oftentimes many people are motivated by what happens if they do nothing, right? What could go wrong? So to parents, they have straight white, or no, I'm sorry, they have white teeth, great looking gums, but their teeth are all crooked. And they have an 8-year-old, 9-year-old, and they're crooked. What's wrong with just letting it go until they're in about 8th or 9th grade?
Well, it's much easier to treat at that early age, and it will cost a lot less if you treat it at that early age than if you wait until it comes to a bigger problem. So,
and can it be done quicker because of that?
Yes. At an early age, it's very easy to modify growth. Let me give you one example, the narrow upper arch. There's a suture there. There's 2 bones with a soft spot in between, just like the baby's born with a soft part in the skull. That hardens by age 15. So you can't even expand the upper palate the way that you can.
So if you want your
before
kid to have a
age
big,
15,
broad smile,
you've got to do it before age 15 for the best result possible.
Okay, good. And you mentioned thumb sucking for just a moment. So when you're traveling or at an airport and you see kids that are sucking their thumbs, I mean, how do you control yourself from stopping them to do it?
What do I say?
I mean, do you say things?
Well, once the permanent teeth come in, it's time for the child to stop sucking their thumb. And I have had patients who were football players in high school who still suck their thumb. I've had women who were getting married still suck their thumb. I've had patients
when do they do it?
in their
They're not doing it in
40s
public anymore.
still suck their thumb. So thumb sucking is a problem.
Are you serious?
That is, it is a habit that is as hard to break as any other habit. It's a very hard habit to break at an older age. For young kids, there are 3 techniques I use to try to get them to stop sucking their thumb. Number 1, you can just put the finger in something that doesn't taste so good, like hot sauce.
Yeah.
And when they taste it, they'll take their finger away. Number 2, you can put a smelly sock on their hand. When they go to sleep, they go like this, they smell it, they put it down. Or number 3, you can put a Band-Aid on it and leave the Band-Aid on so it just doesn't feel good. If all else fails, orthodontists put in a habit appliance. And what it is, it's a metal device. It hangs down. You can't see it from the front, but it prevents the finger from going into the roof of the mouth.
Wow.
And it stops the habit overnight.
Okay.
Thumb sucking is a survival instinct. We're all born with that instinct, but gradually it needs to go away. In some patients, it doesn't go away, and they need help. But it is a serious problem that needs to be corrected as soon as possible.